Welcome. Welcome. Thank you for joining us today. We are presenting on community collaborations for culturally appropriate and flexible food security produce prescription programs. My name is Sissy Bonini. I'm the Executive Director of Vouchers for Veggies, also known as Eat SF in San Francisco. And I'd like to introduce you to Preeti.
Hi, my name is Preeti Rane. I am the Director of Nutrition Services with the San Francisco Department of Public Health.
Great and wonderful. It's wonderful to have you today. We are going to be presenting on a very successful food security intervention here in San Francisco, and Vouchers for Veggies is also in other states and counties in California. We will be specifically talking about produce prescription programs in general, and then talk about our successful partnership with San Francisco Department of Public Health, where we work with low-income pregnant people in the city. So the first part of our presentation today, we're going to talk about the overview of Vouchers for Veggies, and we're going to talk about the WIC partnership. And in part two, we'll talk a little bit more about funding and some details of how the programming works. So to start off, we want to give you a broad overview of what produce prescriptions are and some of the key elements. This is a very lengthy description here. You'll see it on here, but I just wanted to highlight a couple things. The eligibility for produce prescription programs generally is a diagnosis of a chronic disease, oftentimes diet related, food security, or other issue that someone may have difficulty accessing nutritious foods. Note that this eligibility is usually referred through healthcare, but can be through other organizations such as social senior housing, other social service programs, and it is mostly fulfilled through food retail, and we'll talk about that in a little bit later in the presentation. So again, these are a specific type of intervention around these medically supported food interventions. So we want to talk a little bit about how this works, and it's a pretty straightforward process here. And for those of you that are familiar with WIC, this will look familiar to you, WIC being Women, Infant, and Children's Services. The intervention starts as either a card or a voucher that is distributed through a community-based organization or clinic to the patient. The amount is anywhere, it can be generally it's $40 a month, but it can be higher depending on household size for a specified period of time, for 6 or 9 months, for example. Those folks then use this card, a restricted spend card that is good for only fruits and vegetables, or a voucher, a paper voucher that is only good for fruits and vegetables. But those can be redeemed at local stores. In our case, we have the ability to redeem these vouchers or restricted spend cards at both larger grocery stores, corner stores, and farmers markets. And then the participant gets to receive that benefit of fruits and vegetables. Okay, this slide here gives you a quick snapshot of the overall Vouchers for Veggies program. Again, we talk about these flexible distribution points. And again, that's really important to really pinpoint and meet the needs of specific populations. So again, this can be through clinics or community sites. And the distribution sites are all, again, depending on what your community needs. If a lot of folks need culturally relevant items, you might want to have a retail network that includes a lot of corner stores that serve particularly folks from different ethnicities, where there may be Latinx types fruits and vegetables or Asian types fruits and vegetables that may not be available at some of the larger grocery stores. The dose duration and mechanisms, that's really how the program operates. And again, we talked about the specific length of time, and then through these different types of mechanism cards or vouchers. Eligibility can be very flexible depending on your needs of your community, and we've listed some here. In terms of populations, Vouchers for Veggies does operate, as I mentioned earlier, in multiple states and in multiple counties. What's really, really encouraging is that we get consistent results among different geographic regions, rural, semi-rural, urban, and among diverse populations such as seniors, families, varied ethnicities, et cetera. And we find that very encouraging for the efficacy around these produce prescription programs. This next slide talks a little bit about reach, and just to get an idea, prescription programs are very scalable. This just gives you an idea of our partnership here in San Francisco, where we've served over 25,000 households with our Produce RX program, this fruit and vegetable program. You can see that we have been able to reach, this slide's a little bit outdated. This is from 2002. We're up to about 13% now, but that's really 10% of SF households below 200% of federal poverty line. And that just gives you an idea from a pretty moderate intervention that we're operating here that can have great impact on particularly very low income populations. Next slide. So to give you an idea of the participant characteristics, and again, we talk about reaching a lot of those folks that might be most in need in your community. Our program, Vouchers for Veggies here in San Francisco, again, reaches some primarily BIPOC population, and you can see the distribution here on the left-hand side, it is circled, where in particular, I wanted to note that San Francisco has about 6% of our population is Black African-American, but you can see we serve a much greater percentage of folks and also Latinx. So we're reaching a very big BIPOC population, as well as if you look at the second graph over the very, very low food security ratings so we're reaching folks that are both low food security, but also very low monthly income. Our redemption rate for these programs is around 75 to 77%, which is fairly typical for these kinds of programs, and it's actually pretty high. So that means for every dollar spent on the redemption they receive, they will spend 75 to 77% of that. Okay, let's talk about the results of these programs. Vouchers for Veggies is a program of University of California, San Francisco. We are part of the Food Policy, Health, and Hunger Research Program here at UCSF. And that gives us an ability to do quite a bit of robust evaluation. And in this case, we have been operating our program for a number of years, and we have a large sample size of about 4,000 participants. And we did surveys pre and post using validated dietary screeners and food security screeners. And we've seen some really, really positive results. On average, our participants increase their fruit and vegetable consumption by 1 serving a day. And that's very significant. It doesn't sound like a lot, but it is very significant and can lead to immediate health impacts, positive health impacts. Additionally, participants, over 90% of participants overwhelmingly talk about other health positive health outcomes as a result of the program, including eating less junk food, eating more variety of other fruits and vegetables, understanding the health aspects of fruits and vegetables. So again, these are really strong outcome indicators of the success of this program. Next slide. In terms of food security, again, we use the validated screeners, and 30% of folks increase their food security at least 1 level from the beginning of the program to while in the program. Additionally, people extend their food budget. We also see a terrific satisfaction rating with this program. Over 90% of folks are very, very satisfied with the program, so we find that very encouraging. Additionally, we did do some surveys and some studies about folks after the program ends, so after 6 or 12 months after they're no longer receiving vouchers. And over 53% of folks continue to eat the same amount of fruits and vegetables as they did in the program, even without the monetary supplement. So we find that a really strong indicator of potential developing healthy habits in the long run. One of the other interesting and positive outcomes of produce prescription programs is their economic impact on the community. And this slide talks about the economic multiplier of the fruit and vegetable voucher programs. And this research was done by the University of Colorado. And what they have found is that for every dollar spent on fruits and vegetables, there's an economic multiplier of 2.1. And so you see in this slide that if for $2 million spent on fruits and vegetables, that is equivalent to $4.2 million in the local economy, 24 jobs, and $1.2 million in labor income. So now I'm going to turn it over to Preeti, who's going to talk about our partnership with pregnant folks.
Thank you so much, Sissy, for that overview. I will be covering more of the specific and details around our partnership with the San Francisco Department of Public Health WIC program and the Voucher for Veggie program. So starting with the why did we decide to focus on this population of pregnant people? You all know that food insecurity impacts an individual's health outcome. And this impact on health outcomes can be amplified during pregnancy. So food insecurity not only impacts the health of the pregnant person, such as increased rates of gestational diabetes, preeclampsia, increased anxiety, but it also impacts the health of the baby with increased rates of poor health outcomes such as low birth weight and birth defects. So with this intervention, we were hoping to impact a couple of generations of health outcomes. So going on to the next slide. So our work was definitely grounded within health equity. So in San Francisco, we continue to see a huge disparity in rates of preterm birth amongst Latinx, African American, and Pacific Islander pregnant people, which really compelled us to focus in on our pregnant folks, especially those that were enrolled in WIC, because the WIC demographics, or those that are enrolled in the program, the composition is of these individuals, with the Latinx being more than 50% of those that participate in the San Francisco's WIC program at this time. Next slide, please. So going back to where the partnership actually began, so this partnership began back in 2016, and we based this on some of the very core values around reducing health disparities and improving the rates of food security through culturally competent and flexible food options. This was extremely important for us because we do serve a very, very diverse families in San Francisco, and we wanted to make sure that the resources that we were offering was really widely acceptable and amongst a wide range of communities that we were serving in San Francisco. The second goal was to improve the birth outcomes for low pregnant people through this intervention. Nutrition can play such a huge role in impacting the pregnancy outcome, and so we wanted to see if we can make a difference in that. And then, as I mentioned before, equity was our focus, and we really focused on serving our Latinx and African American populations that had the higher rates of low birth in San Francisco. We started with giving families $40 per month of fruit and vegetable. We started with 6 months, and then we scaled it up to now 9 months. And we are serving since 2016. We started with about 200 parents back in 2016 to now over 1,500 pregnant people each year. So just a little overview of how the program works. So what Sissy mentioned before, the eligibility for such a program or intervention can be different, and can look different in different spaces. Within the WIC context, the way it operates is once the pregnant person enrolls into the program, that they automatically become eligible to participate in EDSF, or Voucher for Veggies. So a staff member that is enrolling the person on WIC will tell them also about the EDSF program. So they will not only get the WIC benefits, but also automatically be enrolled in EDSF. Once a participant consents, weekly, one of the WIC team members will then send the list of those that were enrolled in WIC, unless somebody says, well, I don't want to, which in all these years that we have operated the program, we really never had a parent that has turned down additional fruits and vegetable resources. So we will send that list over of eligible participants to the Voucher for Veggie teams. Once the team on the other end receives the information, they load the WIC info into the Voucher for Veggie database. They then send the family a text saying, hey, this is the Voucher for Veggie team, and we will be sending all of the information about the program in the mail in the next couple of days. So that gives the family a heads up to kind of look out for the vouchers in their mail. The packet has all the information that they would need in terms of like how to use the vouchers, where to shop, and so on and so forth. This model worked really well within WIC because our families were already used to using such type of resources. So when we started, we're now on a card, but when we started, we used to give out with vouchers too. So it was very similar, and families were very familiar with it. But even now, it's pretty self-explanatory, but all of that information is contained in the packet. The vouchers get mailed, and then if a family, because we have a lot of households that are multi receiving these in the mail, they have the option to pick it up at the WIC clinic. So some of the key elements for this partnerships was first the data sharing agreement. So we really wanted to make sure that there were very strong data sharing agreements in place so that we were doing this in a way that was maintaining all families that were participating in the program, the confidentiality was maintained. We use the opt-out versus the opt-in enrollment, which means that everybody automatically gets enrolled in the program unless the participant explicitly tells us, no, we don't want to participate. That really has been a game changer in terms of how many families we have been able to serve, because that takes a burden away from actually asking the family to first decide whether they want to enroll or not. They have to decide the other way if they don't want to enroll. So that really has helped us to reach more families. And then, of course, there's very strong, the WIC team and the Voucher for Veggie team work really, really closely with strong communication flows and joint troubleshooting between the two programs. So if there is any issues that come up, any workflows that need to change, are ironed out in an ongoing manner. And the program really has flourished due to this partnership. Next slide. And I will pass it back to Sissy.
Great. Thank you so much, Preeti. Yeah, some of the, just briefly, we'll go over some of the assets of this program and what works with this partnership. And a couple of these areas we want to bring out, of course, is complementary to the WIC program, but it also acts as an incentive. The idea is really encouraging program enrollment in the program and retention in the WIC program. Also, really, really interesting intervention in terms of a local supplement for high cost areas such as San Francisco, Los Angeles, and so many places in the country right now that, the federal level benefits just don't map what you need to feed your family in these areas. So there's a potential to really have that local supplement really bring that benefit back into something that's really workable for the family. The other piece that we've talked about a couple times, but just wanted to mention again, the fact that it's can be designed right from the beginning as a culturally relevant program, including the stores that we work with, the languages that we use in San Francisco, where we have 4 or 5 languages that our information materials are translated into. So we really see that as a strong asset of this design. Next slide. So the question is, how does it work? And as I mentioned before, we're really encouraged by the strong evaluation outcomes of these programs. In this case, this is a published research study speaking to the efficacy of this program with pregnant folks. As we can see, again, the study is done pre and midpoint. There's a 30% increase in food security for our participants, also a 0.73 servings per day of fruit and vegetable intake increase, which is great. But super interesting is there is a 37% reduction in the odds of preterm birth compared to a historical control group. So that points directly to healthcare savings, as well as a lot of, obviously a lot of important health outcomes for the family. Okay, so now we're going into part 2 of the presentation, where we're going to talk a bit about funding and some of the incentive mechanisms. So funding, how do you fund these programs? Lots of lots of ways. There are lots of sources. And again, for produce prescriptions, Vouchers for Veggies, we not only operate produce prescription programs in multiple areas, but we also conduct technical assistance for government and healthcare that wish to implement these programs in their own communities. And we also do research. So all of those elements help fund the program. What is circled here is some of the key funding for this partnership with San Francisco WIC is through San Francisco sugary beverage tax, or well known as soda taxes, as well as local government funding, and then some grants to help supplement the program, particularly around research and development. One of the interesting opportunities that we see upcoming in the future for these programs is within healthcare. And produce prescription programs are part of what's called the medically supportive food and nutrition intervention package that we see now being funded by, being adopted and funded by healthcare. And we're seeing this growing across the country. And again, these include medically tailored meals, medically tailored groceries, but again, you see produce prescriptions right there. Next slide. You'll see for this slide just gives you a progression of our funding that started with grants, and then grant subsidy funding, and then soda tax. And but we really think for scale and consistency, healthcare funding can be a great great revenue source for these programs, and just a great alignment for our participants. Okay, so let's talk about some of the nitty gritty of this program. How are you going to get this on the ground? Okay, one of the key pieces is what technology is used. We call these mechanisms. What is the card technology? Restricted spend, so folks can use the card or the voucher at their local retailer. One of the big challenges we have is that there is WIC, Women in Infant Children, does have a restricted spend card. SNAP is a restricted spend card, but those ride very different rails than produce prescription programs. And that's because that system is restricted. So there has to be a separate mechanism. So that is one challenge that we have that we'll talk about later in the program as an opportunity to change. And the next slide, please. So as a result, our restricted spend cards that are currently available for produce prescription programs pretty much are limited to larger grocery store chains. We're hoping that might change in the future. But we use multiple mechanisms for our programs because we find that it's really important in a lot of communities to reach some of those smaller vendors. And again, because some of those smaller vendors have more appropriate, culturally relevant food options for folks. Also, they can be used at farmers markets, which is a great asset for a lot of folks. Our vouchers are also very digitally enhanced. So our vouchers can be used in certain areas for both larger and smaller grocery stores. So your determination of which mechanism to use really depends on the needs of your participants. In some geographic areas, the majority of folks always shop at grocery stores, so that's a good option for you. In other cases, you might want to do a mix or just the paper voucher. Okay, we're going to move on to conclusions, and Preeti's going to share those with us.
Yeah, so really in conclusion, we've seen time and again that the additional food resources, or specifically for fruit and vegetable within the WIC program, for our pregnant people, have improved food security. It has supported healthy dietary intake and has also contributed to preterm birth reduction. These are extremely popular among our families, and even when they hop off, they will ask, can I continue to get it? And because families really love them. Produce prescriptions and WIC partnerships can support WIC participant and enrollment and retention. So one of the things that we've been seeing since we have started this partnership is families, much of these programs have spread through the word of mouth, right? Of a mom will enroll, and then she'll tell her friend and her sister, or somebody else. So you should sign. And so we're seeing more families that are pregnant enrolling in the program earlier, which is again a key indicator to prevent some of these low birth outcomes and other health outcomes. And so it's really encouraging families to not only sign up early, but also to stay on the program longer. We're exploring new methods and resources of service delivery to maximize efficiency, safety, ease of use, and integration into the WIC program. Like Sissy mentioned, we are a program within a program, and so we're trying to find alignment between the two so that it is as seamless as possible for our shoppers or our participants when they're using these resources at the store, and it's not quite as clunky. And then, of course, in conclusion, we definitely very strongly feel that the produce prescriptions and WIC partnerships are effective, evidence-based food security intervention, and they're really, really well accepted by families. Super easy to use, definitely doable at the local level. Next slide, please. And then lastly, some opportunities for policy and advocacy. So, our findings definitely supported improved health outcomes for pregnant people. And that really helped us advocate for increased WIC benefits at the national level. So this not only helped families in San Francisco, but millions of families throughout the country when there was an increase in the WIC benefit for fruit and vegetable that happened during the pandemic. So we're really super excited that some of these findings were really informed that big policy push. We can sustain scale and replicate successful model program. Definitely, there needs to be different funding sources. Really some of the programmatic restrictions that come along. There definitely are opportunities around policy changes in that at that level. And then finally, allowing local WIC jurisdictions to supplement the fruit and vegetable benefits onto the card, right? Like Sissy mentioned before, it's just cumbersome not only for the families but also for those operationalizing the program, the resources that it takes to run different separate programs like this. It would be really awesome if there can be some push or efforts that can be made to align these two efforts and use the same technologies to provide these essential resources that the families need. So we thank you again for attending our session. Our emails are up on the screen. Please feel to reach out to us with any questions. We're really excited. Our partnership has gone on for so long, and it's really so fulfilling and great to see our families utilizing the program and really see the changes that is made not only in their food insecurity rates, but as a public health department, really see the impact on the health outcomes. So thank you so much.
Thank you.